Let's continue the conversation about ADHD, screens, dopamine, and let's think about like what's different in people with ADHD in how dopamine works in their brain, right? So we know that dopamine levels are often lower in certain parts of the brain, and that can cause issues, right? Issues with attention or motivation or impulse control, and it can make it more difficult to feel stimulated and rewarded, right? So a lot of people with ADHD are prone to seeking stimulation, and probably like one of the scariest things is to be bored, right? To be like left in a room for a few hours, right? To entertain oneself is often like a super scary thing for someone because the brain just craves and needs dopamine, needs stimulation, right? And almost one of the key trainings or practices for someone with ADHD is to practice not chasing stimulation, right? Not chasing dopamine, like learning to live with a dopamine kind of steady trickle rather than like, boof, dopamine hit, right? Another dopamine hit, right? So we're aiming for like small, steady, rewards, internal rewards, rather than like chasing big dopamine hits. That is way more compatible with being peaceful and content and functional in daily life, right? And less likely to get addicted or hooked on something that's like a dopamine hit, right? So this is about seeking things with instant rewards. And social media is definitely, screens, gaming is definitely something that can offer those like quick dopamine dumps, right? And that's like a sense of pleasure or accomplishment or like, satisfaction that someone can feel, even whether they have ADHD or not, right? But definitely someone with ADHD is more vulnerable. And the other thing, it's like it keeps going, right? It's constant and endless, right? It doesn't end. There's more and more and more and more and more, right? And it's hard to know when to stop, right? It just kind of like pulls you in down this channel, down this spiral, right? And that is, being captured, right? Hyper-focused, right? Plus overstimulated. Plus, often people with ADHD have trouble with switching, right? So once they're in something, they want to be in that. It's hard to switch. It takes a lot of energy to switch, right? So it's like a setup to really be sucked in for a long time. And another aspect of this like dopamine hit is that people with ADHD often seek social validation and positive reinforcement. And they often have a lot of negative experiences, teachers saying critical things, bosses saying critical things, spouses saying critical things, right? Boyfriends, girlfriends, right? So, you're not listening, you're late, right? You didn't do this, right? So that there's also this need for some positive reinforcements. For that, it's good, right? It's just not always so positive, right? You can get a mix of positive and negative, but seeking that positive social interaction and reinforcement is another thing that will keep people really glued to whatever screen or device, and potentially like glued for, many, many hours a day to the point of neglecting responsibilities or work, or it cuts into sleep. Right? So that's the other very common thing that I see in my practice is people being on social media, on the phone, late into the night and really struggling to peel themselves off, put the thing away so that they could get enough sleep. There's also more complexity around, the content you're seeing. There could be like, yes, lots of positivity and reinforcement, but there's also a lot of comparing that happens, right? When people use social media, and that could cause issues. So what to do? How to navigate? So first of all, have some boundaries, right? Have for yourself some general idea of like, what's the frame that works for you? In what time of day, what hours, on which devices, right? Is it your intention to, like, first thing in the morning pick up your phone and start looking, right? Or is the intention, no, I'm going to have my morning routine, get my day going, and then in the afternoon or at lunch break or something, right? Like somehow creating some frames and boundaries and guidelines for yourself, right? And then also thinking about, like, what's the most beneficial way to use social media? Is it to tap into supportive communities, connect with friends, connect with communities of interest and that are, like, resonate with you and support you, right? Like how to actually be discerning and mindful in how you choose where you give your attention online. And also important to just, like, zoom out and think about the big picture of your life and, like, is there balance, right? Is there balance in how much time you're living your life online versus, you know, in 3D, in real life, how much you're connecting with people over devices, how much you're actually interacting with people face to face, right? There's a totally different benefit that you get from, you know, in-person interaction. So finding a way to stay balanced in your whole life, right? Being kind, being compassionate to yourself in how you are assessing what's going on right now, and in a loving, kind way, working towards getting the situation on a good path, step by step, you know, in a way that works for you, with this intention of being well, right? Living well, rather than, like, beating yourself up and turning on some, like, you know, more negativity. So just, you know, make sure that you stay in a positive attitude as you're trying to sort this out for yourself. Thank you for watching. I would love to hear about your own experiences with navigating ADHD, navigating dopamine, for individuals with ADHD who struggle with social media or any other screen time, and also individuals without ADHD. You know, what have you figured out? What works for you?